Hi, my name is Dr. Kim Carozzi, and I am a chiropractor here in York, Pennsylvania at ChiroCenter. And I wanted to just take a few minutes and go over the structures of the spine with you. As a chiropractor, I treat a lot of spinal conditions, including herniated discs. And very often patients ask me exactly what that means and what does it look like in their spine when they have a herniated disc. So I'm going to spend a couple of minutes today going over that with you, so if you or anyone you know is suffering with this problem, you'll have an idea as to what that looks like. Now, if we take a look here at the model of a spine, I'm going to be focusing on this back part here. These are what we call vertebrae, okay? These are the bones in your back that hold up your spine. If you were to remove the vertebrae, you can see the spinal cord. And off of the spinal cord, we have branches in between the vertebrae, and these are called nerve roots. Now, these nerves that branch off of your spine, particularly in your low back, run down the back of your legs and into your feet. So very often when people talk about sciatica or nerve pain in the back of their legs and into their feet, these are the nerves that we're dealing with. Irritation of these nerves can be very painful and can be debilitating in some cases. Now, we want to look at why that happens. There's a very important structure in between the vertebrae in your back, and it's a disc. Okay? This disc is a healthy disc. And what we mean by healthy is that the fibers that surround the outside are intact or not torn. Inside the disc, in the nucleus, there's fluid. The fluid keeps the disc hydrated, and when it's like that, it creates a barrier between bones and nerves. So it acts as a spacer or a shock absorber, if you will. When there is wear and tear on the disc, or we have tearing of the fibers, we get to this point and you can see the difference between the two. These fibers are torn, so what happens is the liquid center, the material in the middle of the disc, tries to push its way out, and in so doing creates what we call a bulge or herniation. When we have a herniation, the effect on the nerve, obviously, is going to be one that you can see. When this material tries to push its way out the back, it compresses the nerves that live behind it. When the nerves are compressed, you'll feel very commonly pain in your back and also pain or shock-like symptoms running down your legs and into your feet. Now, the worst case scenario is this situation here, where we have a disc that has broken its way through its outer edges, and the material is then spilling into the canal and completely compressing a nerve. This looks painful, and it actually is very painful. So when we have this situation here, we call that a rupture, or sometimes you'll see extrusion used as a term for what's going on with the disc. Many back problems can be traced to the disc and the health of the disc and its ability to keep bones and nerves away from each other. We're going to do some segments in the future that talk about keeping your discs healthy and what you can do to correct these problems if in fact this is what you're suffering from. So that's just a brief overview of the anatomy and important structures in your spine and in your low back. And if you would like more information on these and many other conditions, I encourage you to visit my website, www.drcarozzi.com, for information on disc herniations and many other conditions we treat as chiropractors. Thank you for taking the time to watch my video.